And good evening, everyone. Welcome to Medical Monday. Thank you so much for being with us. Tonight we have a couple of topics we're going to be discussing. I have Dr. Jon Draud here with me, a psychiatrist. Thank you for being here. The topics of tonight's show, holiday blues, depression, and pain. So we'll be taking a number of calls on different topics. We're going to jump into the holiday blues first, but go ahead and give us a call if you have any questions tonight. The number is on the screen. We'll screen those and be taking those just as soon as we can. But first I want to talk to you, Dr. Draud, about your practice here in town. You stay busy.
Absolutely. Well, so I've been in practice 22 years after doing my psychiatric training at Vanderbilt. I'm remain the medical director of 2 hospitals, both in Murfreesboro, actually. So Trust Point Psychiatric as well as St. Thomas Rutherford. And then I have a private practice in Midtown, Nashville. In addition, I've been on the steering committee for the U.S. Psych Congress, which is a national organization that delivers continuing medical education to psychiatrists, nurse practitioners, mental health professionals around the country. So that's been a wonderful kind of experience to have over the last decade.
So indeed, you do stay very busy. This is home for you. And as we talk about tonight's show, gosh, it's something I think everybody can relate to. And I really want to focus on this holiday blues part of it. We're just entering the holiday season this week, and boy, can it bring up a lot of issues, can it?
Well, absolutely. So euphemistically, it's called the holiday blues. The clinical term for it is SAD, or SAD, which stands for seasonal affective disorder. So this is a legitimate subtype of depression that people who have regular depression year-round can have superimposed on a chemical or clinical depression, or some people simply have SAD only during the winter times. Lots of theories as to why it happens this time of the year. Some of it is simply biological in that our circadian rhythms change. When the days get shorter, there's less sunlight. People produce less serotonin in their central nervous system, and this seems to bring about depression. Then you layer on all of the family stress and kind of losses, unfortunately, that take place this time of the year. And so it's a particularly difficult time for a lot of people, both, you know, psychologically and chemically, if you will.
So if someone notices, I'm always off this time of year, I don't know what to do about it, I don't really know if it's real or it's all in my head, where should someone start with that?
Well, I mean, a good place to start with anything medical is your primary care doctor. So you shouldn't necessarily skip immediately to a psychiatrist or a psychologist, but one should start with his or her primary care doctor to kind of vet this. Sometimes blood work is necessary to make sure there's not a thyroid deficiency or a vitamin deficiency. That having been said, beyond that, there are tremendously effective treatments, both in terms of so-called counseling or psychotherapy. There's medication therapy with psychiatrists, and then there's also light box therapy. So one of the specific treatments for SAD, or seasonal affective disorder, is so-called bright light therapy. And what I would recommend is, if any of our viewers are interested in looking at bright light therapy, again, speak to your doctor. There's a specific threshold of the brightness of light, i.e. 10,000 lux or greater. So lux is the measurement of brightness of light. So you can go to Walmart or Home Depot and buy bright lights that don't reach the clinical threshold of what's proven to be effective.
I lived up north for several years, and this was highly talked about. And a lot of people did this because A, they didn't have to take a drug, and B, it's just gray and dark for so long there. And a lot of people swore by it. Well,
and it's real. There's a science behind it. There's an FDA-approved device that works. It's known that if a person wants to use bright light therapy, it's meant to be done first thing in the morning, minimum of 30 minutes. So when the brain is waking up is when it's the most sensitive to the feel-good properties of bright light. I have multiple patients, doctors, lawyers, etc., who literally sit downtown Nashville with bright light. There's a desk model, a floor model, and there's even a visor.
Really?
Some of my female patients that have to drop their kids off at schools in the morning
have the visor on.
Right? So
I can totally understand that.
It's a very real thing, and it's clinically meaningful, and again, can be superimposed on or separate from baseline depression.
Okay, so let's move from the seasonal affective disorder onto more of the holiday, maybe a more serious holiday blues. I shouldn't say more serious, but when things have moved beyond that, and whether it's this time of year or just in general into depression.
In terms of what to do about a more significant depression?
Yes. Where do you start? Where do you go? Because there is still a very big stigma when it comes to seeking help.
Right. Unfortunately, well, fortunately, not as much anymore. When I started off 22 years ago, the stigma was greater. It's much less now than it was, fortunately, because it's talked about more, it's in the public eye, and realistically because treatments are significantly better. So there's everything from bright light therapy to talk therapy or psychotherapy to exercise therapy. Interestingly, exercise produces many of the same brain changes that psychotherapy and medication therapy can produce. And then, of course, the next level is pharmacologic or medication treatment for depression. And in most cases, more than one modality is helpful. So for instance, for people for whom I'm recommending medication treatment, I always have the discussion that they should consider exercise. And interestingly, there's a dose of exercise.
What's the right dose we should be getting?
Antidepressant, right? It's a great question. So it's a minimum of 5 times a week, 30 to 45 minutes.
Of what kind of exercise?
Interestingly, it has been studied. So most people think it has to be aerobic.
Yeah.
Not so. It can be aerobic, weight training, a mixture. But and people have this fallacy that you have to kill it,
right.
an hour and a half a day kind of a thing. No. 30 to 45 minutes, 5 times a week of whatever kind of exercise you like. And then there are other non-pharmacologic treatments, mindfulness meditation, yoga. So, it's not just all medication, and frankly, the best result is usually gained by a combination of, one or more of these modalities.
And when you see patients and they say, I have felt this way so long, can you help me? Can you help them? For someone who has been going through this for years and years and years, I'm sure there's a helpless feeling there.
Well, yeah, and it can be very bleak. The good news is, in addition to the treatments we've mentioned now, one of the other modalities that I offer in the private practice in Midtown is called TMS, which stands for transcranial magnetic stimulation.
Okay.
Not to be confused with ECT or shock treatments.
Right.
It's not that. It's an outpatient procedure that people come to the office, sit in a chair. It takes about 20 minutes. We localize a specific part of the left frontal part of the brain that's implicated in depression and give a series of electromagnetic energy pulses over a 30-day period. So that's for what you're talking about is there's a term for it clinically called treatment-resistant depression. This is depression that doesn't seem to respond to anything. Talk therapy, light therapy, 5 different rounds of medication therapy. So for that, we recommend an FDA-approved treatment called TMS, transcranial magnetic stimulation. So it's actually a very exciting time to be in behavioral medicine because there are more modalities for treatment than we've ever had before. They're more effective when used in combination than anything we've had before. And it's a much more hopeful kind of long-term vision, than we maybe had 15, 20 years ago. So
I'm intrigued by this TMS. What is the biology? How does it work?
So it's fascinating, actually. So the left frontal cortex of the brain is known to be, interestingly, atrophic or shriveled.
Oh.
In the depressed brain, normally neurons are nice and healthy and connect to each other in a network. In the left frontal parts of the brains of depressed patients, there's actually atrophy or loss of neuronal connection. And so what we're doing, we localize it's a different place for you than for me.
Okay.
Okay, we measure that in the first treatment on a device, and then we localize that, log in the parameters, and every day that specific part of the left frontal brain is stimulated electromagnetically. So it's a brain stimulation strategy. And if you follow the logic, these shriveled neurons over the course of a month's treatment, they begin to reconnect. The term is rearborize, like a tree, the arborization of a tree. So these neurons reconnect with each other and form healthier connections that transmit, brain impulses and neurotransmissions.
And I'm sure there's research to back it up. Have you seen the proof in your own patients?
Oh, absolutely. So there is clear research to the extent that it's an FDA-approved procedure.
Wow.
So people may know, but in order to get something approved for, let's say, depression, as a device, you have to meet the same threshold that all the medications which went before you have met. So there's uncontroverted evidence that it works. And I've done over 500 patients probably in the last few years. And it's really quite remarkable, the improvement. There's a specific, the subset of patients that are known not to respond fully, or remit is the clinical term, from medications and or talk therapy. They are specifically more likely to respond to TMS.
Wow.
So what we think is there's a different kind of depression that is not responsive fully to medications, but is responsive to this magnetic treatment.
And is this something that you have to continue to do, or is it kind of a, you go through one session and you're done?
So it's a very good question. So it's a repetitive technique that takes 30 days, about 20 minutes a day. After the 30 days, we recommend maintenance of approximately once a month.
Okay.
And that becomes, for many patients, that is their treatment.
Wow.
Many people come off medication because of either intolerable side effects, lack of efficacy. There are any number of problems for which people are not interested or willing to continue with medications. Pregnant women.
Yeah.
This is arguably the treatment of choice for a depressed pregnant woman.
Which is a real problem in pregnancy when people are dealing with depression, so many other changes in hormone levels, and then what do you do?
Yeah, absolutely. So this is a legitimate treatment for that, and it's safe enough, and there are, just to be clear, there are no side effects other than sometimes very mild headache, but no systemic side effects like we get with medication treatments.
So it's FDA approved, but does insurance pay for it?
They do.
Wow.
Because it is now FDA approved. At the beginning, it was not approved under insurance, but the term is treatment-resistant depression, which is really interestingly defined as only a failure of 2 or more medications. I mean, strict literature says 1 or more, but practically to get it approved under insurance, a patient needs to have failed 2 or more medication trials and have had some psychotherapy. So, but again, that's at least half of our patients.
Wow.
Meet that threshold.
I bet.
So this is an exciting time to have something new and innovative.
I would say. Okay, we're going to have to take another quick break. When we come back, again, we're talking about holiday blues, depression coupled with pain. If you're dealing with that, have questions, go ahead and give us a call. We're here to answer them. Stay with us.